Good morning. Thank you for coming to our workshop. This is Searching Medline, Finding the Evidence You Need. My name is Melanie. I'm one of the information specialists here at UHN. And there are 4 of us here in the workshop right now, so we'll be helping you out in the chat, dropping links, answering questions. We're all here to help, and do feel free to ask any questions that you have at any time. And if you want to find us outside of this workshop, you can find all of us and other contact information at UHNLibraries.ca. So our objectives today are going to be looking at coming up with a good search strategy for the thing that you are aiming to accomplish. We're going to talk a little bit about different kinds of searches and why they might work better for different kinds of projects, as well as some of the tools that you're going to find in Ovid Medline, as well as in most other research databases. And we will briefly go over some useful tools that are in databases for just keeping track of your existing searches. So you can save searches and rerun them. You can export results. You can create alerts and things like that. And we'll also touch on ways that you can improve a search that's not going very well. So let's get going. To very, very start with, we are talking about Medline, and I want to emphasize that Medline is one database, and it is a subject-specific database, so it is very medicine-focused. It is very North America-focused. There are other databases that have other content and other focuses, but there's also databases that have material that is different from what you will find in research databases. So research databases tend to focus on journal articles, but there's also preprints, there's also registered research, there's also conference material and textbooks, and there's government reports. So there's lots of material out there, and not all of it is going to be found doing a search of Medline. So we are focusing on the Medline today, but if you have any questions about other types of resources that you might want to be looking at for your specific project, contact the library and we will be more than happy to chat with you about your other options. So the very, very start of searching a database is, before you even thought about which database to use, you need to think about having a searchable question. So your research question is whatever question it is that you're trying to answer at any given point. That is up to you. Whatever your research question is whatever your research question is. Whether a question is searchable depends on it being something that you're going to be able to use to develop a strategy that will be feasible in the database, as well as provide you with a feasible number of articles to go through. So you're looking for something pretty specific. Your pretty specific question needs to have at least 2 concepts. You can, depending on your project, have more than one searchable question for your per research question. So if you're doing something like a systematic review, your research question probably needs to be the same thing as your searchable question. But most other things, you can have your research question and then come up with a list of searchable questions that you can use to address it. So let's take a look at a couple of examples. So if your research question were to be effective interventions for pain in breast cancer patients, that might be a little bit too broad to be searchable. You probably would end up with a very, very large number of citations if you were to try to look at all pain and all interventions in breast cancer patients. But you could break down that research question into a number of searchable questions. So for example, self-management interventions for pain in breast cancer patients, or opioids for pain in breast cancer patients, etc. So it needs to be specific. There needs to be at least 2 concepts, but you can have more than one question, so, which means you can run more than one search. That's fine, depending on your project. Here's an example of where your research question might be fine as a searchable question. This is very specific. We have one specific therapy that we're interested in. We've got two pretty specific symptoms that we're interested in, and we've got a pretty specific population that we're interested. So we've got a question that is specific enough that if we were to break this down into concepts and enter it into a database, we probably are not going to be overwhelmed with millions of results. For the concepts piece, if you want to, there are a lot of different ways to turn a given topic into a searchable question. One of them that you will see a lot is Pico. Pico doesn't work for every possible question, but concept boxes basically do, because they're relatively non-specific. So if you can write down your question as a single sentence, then you probably have a reasonable grasp on the sort of concrete ideas that you're interested in actually finding. And then you take your single sentence question and you pull out the important parts. So in this question, in patients at risk for pulmonary embolism, is heparin or warfarin a more effective treatment? We've got three very concrete, specific concepts here. We've got pulmonary embolism, we've got warfarin, and we've got heparin. And we can put those into separate concrete concept boxes, pulmonary embolism, warfarin, and heparin. And then we can start thinking about what are the other terms that people might use if they're talking about this concept. So for drug terms, there might be other names for the drugs, depending on brand names in other countries and doses and things like that. For pulmonary embolism, there's also a pulmonary thromboembolism, and like for different concepts, there might be a British spelling and an American spelling, or there might be different tenses. Or if you were interested in a concept like quality of life, there might be specific aspects of quality of life that would go into there, like mobility or participation in the activities of daily life, or those kinds of ideas. So you can start listing out what would go into each of those. And if when you are brainstorming synonyms, you're finding that you've got a lot of synonyms and they're maybe not super related, you might start at that point to get an idea that maybe your question is broader than you want to do as a single search. Let's take a look at the next idea that you're going to need to think about before you get into your database searching. It's very helpful before you get started to have an idea in your head about how you will know you are done searching, because otherwise you can just keep searching forever, because there's always more ways to search and there's always more places to search. So you want, before you get started, to have an idea of both what is feasible. So how much time do I have to devote to this? What is a number of articles that I could reasonably look at? But also what is required for the type of project that I'm working on. So for something like a systematic review, what is required is that you do everything you can to find literally everything that is ever talked about your topic. Where if you're just doing a presentation or you're looking for some high quality articles to use for evidence in a clinical situation, you might just be looking for a couple of very high quality recent articles, for instance. So you want to have an idea of that ahead of time. So you'll want to think about, what do I need? And if I'm not sure what I need, where do I look for that? So for things like systematic reviews, you would want to be checking out guidelines to help you sort out what's actually required. All of the feasibility stuff is up to you, though. So when we're going to the databases and we're thinking about depth, we are going to be doing basic searching today. So this is what basic searching might look like for epilepsy. So this is for, I need to go in, I need to find a reasonable number of reasonably high quality articles on my topic. maybe for a clinical question, maybe because I'm writing a background section for something, maybe because I'm doing a presentation and I need a few citations to back something up. Basic search, I need a couple of things. This is not the only kind of search, though. For some kinds of knowledge syntheses or other kinds of projects, you might want to be doing something more like iterative searching. So you have a small number of very relevant terms at the beginning, but then as you're going through your results, maybe you're finding new terms or you're finding new ideas that have to do with your concept. And so you go back into the database and you search those. And you do that for as long as it makes sense to keep doing that. So it might be until you feel like you're not finding anything new, any new answers to your question, or it might be until you feel like you have a good solid pattern that you've found in the literature, and you've got enough to back up that you have in fact identified a pattern. So iterative searching, it's a thing you might find useful for some kinds of projects. And then there's exhaustive searching. So for the same concept, epilepsy, if you were doing something like a systematic review, your epilepsy search might look something more like this. So in this kind of searching, you're aiming to find all of the literature that has used any term that anyone has ever used to describe the concept that you're looking for. Let's talk about the tools that we're going to be using in the database in order to find our concepts. Our very first tool that we're going to talk about, this is probably the single most important tool that you will use in most health sciences databases. This is subject headings. So subject headings are like hashtags that the folks at the database have assigned to the articles to tell you what that article is about. So it's not, here is something that gets mentioned in this article. It's not, here are words that the author has used in this article. It's, this is what this article is about. So in Medline, the subject heading system that they use is called MESH. So that's MESH. So it's medical subject headings. And when you're searching MESH in Medline, you're searching a separate field from the rest of the sort of information that is about the article that is in the database. So in Medline, if you're searching for instance, data analysis as a subject heading, you're going to find this article regardless of if the author has used the term data analysis in the title, abstract, or keywords. So someone at the database has assigned data analysis. This article is about data analysis. So you will find this article and any other articles that the folks at the database have looked at and said these are about data analysis. Even though this article uses, it looks like network analysis instead in the title and abstract. So this is a way to do pretty precise searching. So instead of searching looking for words that the author happens to have used somewhere, you are searching to find things that some person has looked at them and said, not just this is a word that is related, but this is the topic, this is the subject of this article. Subject headings are database and platform specific. So the subject headings that you use in Medline are different from the subject headings that you use in Embase, are different from the subject headings that you use in CINAHL. And this is important to keep in mind because this is the reason why it is important to search one database at a time and to individually in each database look up what the subject heading for your concept is, because it's not necessarily going to be the same. You can't just use the Medline databases in CINAHL and expect to get and expect to get useful results. Our next tool are keywords, and keywords are confusing in a couple of different ways, and we'll talk about it. So keyword searching in databases is when you type in some words into the search box and then the database searches for those words. So if you're searching in something like PubMed or in like Google or another sort of web searching tool like that, you do keyword searching all of the time. That's what you're doing in those types of tools. But in Google and PubMed and a few other resources like that, it's taking the keywords that you type in and it's applying a few algorithms to them and saying, okay, so here are things where the words that you put in showed up, but also here are some other things that, based on the words that you put in, we think are probably relevant to you. In research databases like Ovid Medline, EBSCO Medline, CINAHL, Embase, things like that. When you are doing keyword searching, instead of there being algorithms that are going, okay, so we know you put in these words, but we think you're probably also interested in this other stuff. The database is just literally taking the characters that you've typed in the order that you've typed them in and saying, okay, here are all the articles that use those characters in that order. So in tools like Ovid Medline, if you're doing keyword searching, you need to be thinking about what are all of the words and terms and phrases that authors might have used to say the thing that I'm interested in. So would they be using the British or American spelling? Might it be plural? Might it be past tense or present tense? Might there just be really important acronyms that people use instead of the whole term? Those kinds of things. So keywords, when you're searching them in Medline and Embase and CINAHL and that, the reason you're using keywords is maybe there aren't subject headings assigned yet, or maybe you need to be extra thorough, or maybe there isn't a good subject heading for the concept you're looking for. So you need to search in the title, the abstract, or what's called the keyword field. In Medline, it's keyword heading. And that's one of the reasons why the term keywords is confusing, because it's a field, but also it's a thing that you type into the search bar. So the keyword heading is where the keywords that are assigned by the author or the journal show up. So when you're keyword searching, you're not just searching that field. You are searching usually the title, usually the abstract, often some other fields as well. And this is especially important if you're looking for very, very new articles, because they might not have subject headings assigned yet, or if your concept doesn't really have a good subject heading in that database. The next tools we're going to be using are Boolean, so and, or, and not, and this is how we're going to combine our different words together to get the sort of most thorough and least complicated search that we can. So and narrows your results. It will be finding you only the articles that have both of the ideas in it. So it's both and. So in this example, the articles that you would find have to have both cats and dogs in them. Or broadens your results. So in this example, you would be finding any article that either has cats or has dogs or has cats and dogs. And then not, which is a term that we are going to recommend that you don't use. narrows your results. So in this case, you would be finding only the articles that are only about cats and not any of the articles that have cats, but also have dogs. So the reason that you would largely want to be ignoring this, not as almost never useful, is that most of the time, if there's something that you think you want to not out, that term will show up in articles that are relevant to you, and by nodding that term out, you will miss those articles. So we're gonna ask you to ignore the existence of not for now. So this is what it would look like with one of our examples from before. So if we've got our breast cancer concept and our self-management concept and our pain concept, we would be oring within a column and anding between columns, or else you can see how that would look in a Venn diagram here. So within a circle, we would be oring, and then between circles, we are anding. And I'll show you what that looks like in a database when we get to the demo. Finally, we are going to be showing you filters. Filters are tools that are built into most databases that help you focus your results to the kinds of articles that are most likely to be most helpful to you. So there's almost always a filter for humans to get rid of animal studies. There's always a date limits filter, so that you can, if you really only need to see articles from like the last 5 years or the last 10 years, you can do that. There's usually some form of study types filters. So if you want to only find RCTs, there's usually a way for you to do that using a filter. And then there's also filters like language limits. There's usually filters by the sex of the study participant. There's usually filters for like country or region. There's lots and lots of filters, and we'll take a look at what they look like and where you can find them. And also we'll talk a little bit about which ones are most useful and which ones you should generally avoid. They are different by database, so the filters that you find in Ovid Medline aren't necessarily going to be available to you in all of the other databases, but most databases have some kind of filters that you can use. Okay, so our steps, and this applies for most databases that you would be searching in, where you are trying to do a precise search, and especially if there are subject headings available. So your steps are to choose one concept at a time. So we can start with, in the previous example, we could start with pulmonary embolism. And then we can look for subject headings that mean that concept. So in the case of something quite specific like pulmonary embolism, there probably is going to be only one subject heading, but there might be more depending on what your concept is. So you're going to look for all your subject headings that are relevant to you, and then you're going to use keywords as well. And depending on the project that you're working on, that might be just a couple of the most important keywords for your idea, or it might be on up to like that example for a systematic review, where you're like all of the keywords that anybody might use at any time. And then you're going to take all of those subject headings and keywords and you're going to OR them together, and I'll show you what that looks like. And once you've done that and you're happy with that concept and you've finished finding everything that you can find for pulmonary embolism, then you move on to your next concept. And you do the same thing. So you find all your subject headings, you use all your keywords, you OR them all together. And then once you've got those two concepts and you've ORed them all together, then you would AND between the concepts, and we'll show you what that looks like. And then once you've done all of your concepts, you can move on to filters. So let's show you some Medline now. So on UHNLibraries.ca, that's what this looks like right here. You can find Medline and the other databases down under featured databases. We've got the ones that most people are looking for most of the time just listed here, but there's tons more databases under the More Databases link. We're going to be using Ovid Medline today. I've already got it open so that we didn't have to wait for it to open. So let's use our breast cancer and self-management of pain question. So we will start with one concept at a time. So we're going to start with breast cancer. So in order to look for subject headings in the Ovid databases, so all of the Ovid databases have this up here, and you'll find the specific database that you're in here. What you do is you type in a keyword for your concept, and you make sure that this box here, map term to subject heading, is checked off. So let's start with breast cancer. So we type in breast cancer, and then we've got this checked off. So when we hit search, it's going to take the words that I typed in, and it's going to look at all of the articles in Medline, and it's going to say, okay, these are the subject headings that are showing up most often where breast cancer is in that article. So in our case, there's only one suggested subject heading, breast neoplasms. But often when you look for a subject heading, there'll be a longer list. So you would want to look through that list and see, is there a subject heading here that means what I'm looking for? So not it's sort of related to what I'm looking for, but it means the thing that I'm looking for. If we're not sure how the database is using a subject heading, we can see what their definition of the term is, which isn't necessarily going to be the same as what you would expect their definition of the term to be, as well as some other information about the subject heading in the scope note. So most of the time, if there's subject headings, there are scope notes. In a lot of the other databases that have subject headings, the scope notes are not super useful. It's still a good idea to check them, but they're often not as useful as what we'll be looking at right now. So Medline tends to have very useful scope notes with lots of helpful information in them, including the definition that they are using. In this case, it's quite unexpected. Breast neoplasms is tumors or cancer of the human breast. But you'll also find other information, like when you're supposed to use it and when you're not supposed to use it. In our case, we can see that if we search for breast neoplasms, that's only going to find human articles. If we want to find animal-related breast cancers, we would need to look for mammary neoplasms animal. We can also see, this is a list of the words that an author can have used, where the person at the database who is assigning subject headings would say, oh, it says mammary cancer, so I'm going to assign breast neoplasms. So that can help you also to determine if this is the right subject heading for you. Everything that is also in all caps is also another subject heading. So if you're looking at a scope note and you see something that is in all caps that looks like it might be relevant to you, then you can take note of that and also consider adding it to your search. In Ovid, if there's a previous page link up here, you should use that instead of using the browser's back button, because if you use the browser's back button, sometimes Ovid gets a little confused and it might give you an error message. So if it says previous page, use that instead of back. So we checked the scope note. The next thing we're going to do is click on the subject heading itself. So clicking on the subject heading itself takes us to what's called the tree. So subject headings are usually, and very much so in the mesh subject heading system, but generally speaking, other subject heading systems are hierarchical as well, from very broad diseases, all of diseases, through to very, very narrow, so carcinoma lobular. So in our case, we looked for breast neoplasms, and we can see that there are, there's a more broad term, which is neoplasms by site. That's pretty broad. We're not really interested in all neoplasms by site. So we probably are happy with breast neoplasms, unless we take a look at this list and we're like, oh, well, actually, I'm more specifically interested in inflammatory breast neoplasms, in which case we can uncheck that one and check this one off. Now, if we are interested in breast neoplasms and we're also interested in all of these narrower terms underneath it, we could individually check these off, or what's more often going to be useful is to explode our subject heading. So if we check this button off here and we explode breast neoplasms, then when we add this to our search, Medline is going to show us all of the articles that have either breast neoplasms assigned as a subject heading, or that have breast carcinoma in situ assigned as a subject heading, or breast neoplasms male assigned as a subject heading, etc. So it's going to show us everything that has any of these subject headings assigned to it. So let's continue from here. Let's say we're happy with breast neoplasms as a subject heading, and we've decided that any of these subject headings are relevant to us. We're going to hit on continue, and then we're basically always going to pretend that the subheadings aren't here. They're not generally assigned in a very consistent manner, so they're usually not useful. There are a very rare set of circumstances in which I would recommend that you use subheadings for anything. So almost always we're going to skip this. You can just treat that as a rule to just skip the subheadings, hit continue again. So now we have searched for breast neoplasms as a subject heading, and it is exploded. And this is the number of results that we found. So we would keep doing that until we're reasonably happy that we have found all of the subject headings that might be useful. In our case, for breast cancer, there are relatively few other terms that we could expect would also have subject headings that would also mean breast cancer. So we're going to say, for now, okay, we're happy with this as our subject heading search. So now, to make sure that we find any articles that are too new to have subject headings assigned to them, we're also going to do some keyword searching. So for this, I'm going to type in breast asterisk ADJ2 cancer asterisk .mp . So when we're keyword searching, since we are in a database that isn't going to do a bunch of the thinking for us, we want to use as many shortcuts as we can to avoid having to type out each individual phrase that someone might use to say breast cancer. So in this case, the asterisk at the end of breast is going to find breast or breasts, or potentially there might be other endings for the word breast. The asterisk at the end of cancer is going to find cancer, cancers, cancerous, all of those other possible endings for cancer. And the ADJ2 that's in between them is telling the database that we don't care what order these words are in. As long as these words are within 2 words of each other, we're interested. We would like to see those articles. And you can adjust that to up or down. So you can say, I would like these words to only be right beside each other and make it be an ADJ1. Or you can say, as long as they're in the same paragraph, I'm fine with that as well. And you could make it an ADJ10 if you wanted. Those are all available to you. So you can play around with that number and sort of find where you're getting the optimal results. In general, if you're aiming to do a just sort of a quick basic search, ADJ2 is probably fine. If you're needing to do something that's much more comprehensive, you're probably wanting to do something more like a 4 or a 6. there, but definitely play around and see what your see what works best for your concept, for your project. Now the .mp dot at the end is a field code that is telling the database where to look for breast ADJ2 cancer. So by where, we mean, are we interested in the title? Are we interested in the abstract? Are we interested in the author assigned keywords? Are we interested in the drug registry numbers? What fields are we interested in? So .mp dot is the sort of default field code that you would be doing keyword searching in Ovid in. It's going to search basically all of the fields that you're likely to care about. The title, the abstract, the author assigned keywords. It searches the subject headings as well. So if you've missed a subject heading, this can sort of help tidy that up for you. It searches the drug registry fields. There's a number of other places that it searches. So most of the time, you can just use .mp. If you need to be more precise than that, there's a lot of other fields that you can specifically choose. So if you might only want to search the title and abstract, you might only want to search the title and author assigned keywords. You might only want to search the drug registry numbers. And if you're interested in finding other field codes, you can either do something like Google Ovid Medline field guide and find a very long document that will have a lot of coding information in it that you can sort of sort through, or just contact the library. We're happy to chat with you about how to optimize your keyword searching for any given search that you're doing. So let's go with .mp for now. We're going to go breast ADJ2 cancer. So now we've got all of these results as well. So we would keep doing that until we're happy with our keyword keywords. And when you're done with your keywords depends entirely on how much stuff you need to find and how many different terms are really important for your concept. So for something very concrete like a specific drug, there might not be that many keywords that you need to search for if you're just doing a basic search. If you're doing something that's much more conceptually complex, like quality of life, for instance, you might have a lot of keywords, depending on what specifically about quality of life you're interested in. So for now, let's say we're happy with this for breast cancer. We're going to take these two terms, we're going to check them off, and then because these belong in the same bubble, we're going to OR them together. So now we're finding all of the articles that either have one of these subject headings assigned to them or have the word breast with the word cancer within 2 words of each other in any of the fields that we have searched. So we find this set of results. So now we can move on to our next concept. So let's very quickly just do pain. So we're going to look for a subject heading for pain. There's a lot of subject headings that are suggested here. Pain is one of them. So let's click on that and we can see what that looks like in the hierarchy. So we've got pain, and then there's a lot of specific pains that are below it in the hierarchy. Now, we can check the scope notes for all of these. We can also decide to ourselves, okay, so we're interested in pain, but we're not actually interested in earache in this population. So we could theoretically go through and just check off the ones that we're most interested in. But here's the thing, if we're looking for articles that are about breast cancer, most of these that aren't relevant are going to disappear once we've combined with and. So we probably don't need to worry about earache showing up in our results. And even if it did, there's not going to be very many of them because there's not very many earache articles. So we can reasonably safely, if we're interested in most kinds of pain in breast cancer patients, we can reasonably safely check this off because the ones that are relevant to breast cancer patients are going to be the ones that are going to show up. Now, if we were looking at this list and we were to realize, oh, actually, we're not interested in pain in general, but having looked at the scope notes, maybe we're really only interested in neuralgia. We can check that off and just explode that term and search for that. That is also available. Since we're being a little more general here, we can just check off pain and check off explode. And this is going to find any of the pain subject headings. And then we will combine that with breast cancer. So let's continue and skip the subheadings and continue. And then we would do our keywords. So we're probably going to do pain. We're probably going to do discomfort. We might do neuralgia if nerve pain is something that we're interested in, and we would keep going until we were happy with our pain section, and then we would OR them all together, and then we would AND with our other concepts. So I'm just going to show you a search that I did earlier to save a little bit of time. So you can create searches and save them in Ovid. And then you can rerun them later if you want to find any new results or if you weren't finished working on that search yet. So here we have a search for our self-management of pain in breast cancer patients question. We've got a breast cancer section here, which we've OR'd together. We've got a pain section here, which we've OR'd together, 4, 5, 6. And then we've got a self-management section here, which we've OR'd together. And then we've checked off 3, 7, and 12, which is where the full results for each of those sections are. And we've ANDed them together using the AND button here. So now we've gotten down to, with all of those terms, we've gotten down to 83 results total, which is actually pretty good in Medline considering the very large number of articles that are in Medline, but you still might not want to look through all 83 articles. So let's say we've got this search, we're happy with these terms, the results are looking pretty relevant, but maybe there's something that we can do to focus in on the most useful possible articles. So we can scroll down here a little bit and we can see these are filters in the Ovid databases. They're called limits. These are the filters that just show up underneath the search box when you access Ovid Medline from UHN. Different institutions might have different filters that show up here automatically, and you can just add these to your search by, if you just want the last line, you can just say I would like English language articles about humans, hit search again, and that's going to take your last line. That's going to take your last line and add those filters. So 13 limited to English language and humans. That got rid of a few. 63 might still be more than you necessarily want to take a look at. So you can add an age group limit. You can limit to one of the clinical queries filters. So these are filters which sort of behind the scenes add an extra little search string to your search to find review articles or articles that are likely to answer a therapy effectiveness question, or articles that are likely to answer a which diagnostic test is best question, prognosis questions, causation questions, etc. So in our case, if we're looking for what self-management techniques are most effective, then we might say we want to try a therapy filter. And we can add that, and now we're down to a very, very reasonable number of articles. We can also take a look under additional limits to find all of the other limits, because there's a lot of them, and we don't necessarily want them to clutter up the main search page. So a lot of them are sort of behind the scenes. So there's age groups, there's animal types, there's specific publication types. So if you only wanted to look at clinical trials or RCTs or meta-analyses or whatever, you can apply that limit here. There's the clinical queries again. There's also some that are somewhat less useful. Like, I'm not sure I've ever found a subject subsets limit useful, or a journal subsets limit very useful. But they're all here. They're all here for you to take a look at and play with. And just remember, you can't break a search. If you apply a limit and you realize, oh well, that didn't help at all, you can always just remove it and go back to looking at your full set of results. Some of the limits I am going to recommend that you avoid using, though, are the full text limits. Since you have access to many journals that are in different databases than this one, you actually would be limiting yourself to fewer full text articles than you otherwise have access to by adding a full text limit, because it's going to limit you to the articles that are available either in this database or in the Ovid databases specifically. So I'll show you back in the results page how you can look for full text between all of the other resources that you have access to. So these are the other limits here. There's also publication year, so you can specifically say, okay, these are the publication years I'm interested in. Or if you just want to quickly add a last 5 years limit, you can select your limit and then click on limit a search. And that's going to get you down to an even smaller number. So for finding full text, if you are in any of the databases from UHN, or you've clicked on the PubMed link to search PubMed, when you're looking at your results, you'll see these Find It at UHN buttons. And these buttons will search for this article in all of the library, all of the UHN library, to see if you have access to the full text of it through any of the resources. So that way you're not limited to just the ones that happen to be in full text in Medline, for instance. If you're looking to print, export, or save your results, you can save your search either by clicking on Save All, and then it'll prompt you to log in or create an account, and then you just need to give it a search name and make sure that the database and the date are either in the search name or in the comment field, because it doesn't keep track of which database you've created a given search in. So if you go back into Ovid to run it, you might accidentally end up running your M-based searches in Medline or vice versa. So just make sure the name of the database is in there. You can also save from individual lines. So let's say, well, actually, this pain section is going to be useful for me for a different project, but I don't really need the rest of this search. You can go to More under Actions beside the line that you need to save, and you can hit Save there as well. You can, when you're saving a search, you can save it either as a search that you can rerun later or as an auto alert that will send you an email when there's new results. Talk to your information specialist about the details for that. You can also deal with the results themselves. So you can either check off specific results that you're interested in, or you can, as long as you've got a reasonable number of results, I think it's under 2,000 that you would want to do this with. You can check off all, or just type in a range, and then print your results or email your results, or export your results in a format that you can send to something like that you can upload into something like EndNote or Zotero. RIS works well for that. Or if you just want to be able to see your results in a Word document or an Excel sheet, you can do that as well. So that very quickly was our demo. Let's go back to our slides and talk briefly about some of the things that we pointed out there. So for keywords, these are the sort of tools for keyword searching that we talked about. When you're looking at your search history in Ovid Medline, if there's an EXP or there's a slash, that means it's a subject heading. So you have found a subject heading for a given term. The EXP means that you've exploded it. .mp is a field code. It's telling the database what fields to look for that term in. ADJ tells it how far apart your words can be when you've done a multiple word keyword search. And then the asterisk is truncation, which means that it can find any ending to that word. If we're looking at the complete strategy here, we've got breast neoplasms as a exploded subject heading. We've got breast cancer with an adjacency of 2. And all of these words are anded and or'd together to get us down to our filtered results, which yesterday were 25. Now, what if we have weird or bad results? If you've got too many results, you want to probably use fewer or more specific terms, and you want to use potentially different or more limits, or you may need to add a concept. So if we had found an absurd number of articles from our existing search, maybe we would want to say self-management of pain in post-operative breast cancer patients. Maybe we want to be more specific about that. If we didn't find anything, we would want more or different terms. We would want to use fewer limits, probably no limits if we didn't find anything at all. You might try removing a concept. So if in our previous example, we had found there were 0 results for self-management of pain in breast cancer patients, maybe we would switch to looking for self-management in breast cancer patients and see if any of the articles that came up, maybe they're about self-management, but maybe the word pain didn't happen to show up in the title or abstract. So maybe they're addressing pain in the full text, but we can't search the full text, so we didn't find those articles. Maybe that would be something to consider. And then for strange results, which do happen, it would be a good idea to double check the scope notes for any subject headings that you used, because maybe the database is using a different definition than you are. But it's also important to look through maybe the first page of results to see if maybe one of the keywords that you're using to mean the concept that's relevant to you, maybe other people are using that term to mean something entirely different. So an example for this might be like you're interested in finding out the evidence for a specific teaching practice in a I don't know, anatomy course. Maybe that would be, maybe you're interested in education articles for medical students or something, and you're looking for different ways that you can teach a course. And you were looking at the results and you're like, these are very, very strange results. Well, the word course, if that's something that you've used in your search strategy, is going to show up for course of treatment. It's going to show up for course of illness. It's going to show up for a number of other things because other people just use that word to mean something entirely different from what you are looking for. So scan through the results and see if other people are using a word that you're trying to use differently than you use it. And then how you might fix that, if that is turning out to be the case, is you might need to remove that word, or you might need to make that word be adjacent to something else. So in the case of course, maybe you would want to say, okay, course, but we're specifically interested in anatomy courses or education courses or I don't know, research courses or something like that. So you might try adjusting that keyword that way. So that concludes our Medline workshop today. If you have any questions, we'd be more than happy to answer them. You can get a hold of us at UHN Libraries at UHN.ca, or you can find all of the contact information for me or any of the other information specialists at the contact page on UHNLibraries.ca. So do feel free to send us any questions that you've got, or if you would like to request that someone do a literature search for you, or if you have any questions about training that you can arrange for yourself or your team, contact us there. We're more than happy to help. Services are free to anybody who is affiliated with UHN. Thank you for coming one more time, and have a great day. Thanks. Bye-bye.